It's Dr. Katie, sharing knowledge, liberating minds. Hello there, how are you all doing today? My name is Sarah Adino. Thank you so much for joining me on this special edition of your #1 educative online podcast, Talk to Katie. Now, in this edition, we'll be talking exhaustively about common infections in women. Yes, common infections in women. You see, quite a number of infections are peculiar to women, okay, and they can be contracted through several means. If not properly treated, you see, some of these infections can eventually destroy vital organs of the body, and some can even lead to loss of life. Okay, so that's why we thought it's wise to talk about this very important topic today: common infections in women. And please, this topic is not gender sensitive. Okay, don't say because I'm a man, then I will watch when it is the edition for men. Okay, we actually have 2 women in the studio, so as a man, what am I watching for? No, it is not gender sensitive, because even if you're a man, you have a wife, of course, you have a sister, you have a female customer, sure, as a consultant, so please, it is for everybody. Please sit back, relax as we take you through some of the symptoms, the causes, and of course the possible solution of common infections in women. Now, to do justice to this topic today is one of our few female guests. Yes, on Talk to Kelly, we have few female guests. We have men. Men, I think I need to look into that, okay, anytime soon. So we have one of our few female guests in the studio. She's a medical practitioner who majors in nutrition and women health. Nutrition and women health. Some of you must have seen her before. Yes, she was here, say last year or 2 years ago. 2 years ago. Yes, and she's here again today. I'm so excited to have her. I mean, before we went live, she had been cracking me up, and I'm pretty sure that she will do the same for you and also impact you today. Please welcome with me to Talk Together Studio for the second time, Dr. Becky Gustin.
Hello.
Thank you so much for coming on today, ma'am.
Thank you for having me.
I am happy to have you.
I'm happy to be here.
Thank you. So in case you're tuning in for the first time, this is Talk to Kelly, where we share knowledge and we liberate minds. This broadcast comes your way from the stable of Kelly Healthcare Industries Nigeria Limited, leading provider of quality healthcare products and solutions in Nigeria. Now, this broadcast comes your way fortnightly on Thursdays by 12 p.m. Please do not miss any edition of Talk to Kelly. And please don't forget that our anniversary activities are still on. Talk to Kelly is celebrating our 4th anniversary. Yes, and our activities are on. So we have an ongoing online quiz. Participate, and we'll be having another round of the quiz. That's 2 rounds. Finally, we'll be having the anniversary broadcast. Please don't miss out on any of these activities. Thank you so much. Thank you for always tuning in. Now let's get down to the business of the day without wasting time at all. Why? Because I want my guests to have enough time to talk to us. That's one. And number 2, because I want you also to have enough time to ask your questions, get your answers before we call it a day on this edition of Talk to Kate, okay? Now, common infections in women actually vary in type, in causes, and then in symptoms. They not only compromise women's health, but can also lead to serious health complications in women, and even death sometimes, if not properly treated, and of course, if not diagnosed early. Now, the prevalence of these infections varies across different regions, but the impact is universally profound, affecting women's quality of life, their families, and their communities. You will be shocked to know the number of women who are battling with severe ailments as a result of not properly treated infection. That is why this topic was deemed necessary. So please, I want you to please sit back, get a notepad if you may, get a pen, and let us take down valid points, because together we need to bring these things to its barest minimum. Some of these infections can be prevented. That's the good news, right? Sure. Some of them can be prevented. So I think maybe lack of knowledge, maybe negligence. I don't even know what the reasons are. That's why many women still fall into some of these things. but I am not the doctor, she is. I will be handing over to her. This is just an introduction. Don't forget that you can be part of the comments, part of the conversation in the comment section. You also have the opportunity to air your opinion. You're watching us, you're a medical practitioner, or you have handled a case as a clinic consultant. Make it on the comment section and share your opinion with us. Okay, if you have questions with regards to how you can use Kedi products to tackle some common infections, please make it on the comment section, and of course we will take your questions and your contributions. Okay, Dr. Becky, are you ready for us? If you're ready for us, give us a high smile. All right, let's get down. My first question is this. In my introduction, I mentioned that infection in women can vary in types. It can vary in causes and the symptoms. So tell us, what are the most common infections affecting women today? The most common ones that almost maybe 70% of women can relate to.
Okay, thank you for having me here once again. The common infection I know I personally, as a practitioner, handle almost every day: vaginitis, which is a toilet infection, candidiasis, chlamydia, hips, and bacterial infections. And most of these infections, if handled, on time, can really stop so many things, like you said in your introduction. Because these common infections, when you leave them, it develops, into a serious problem. So those are the common infections I know as a practitioner. I get to meet women that complains about it daily.
Okay, so without missing words, ma'am, I want to tell us, how complicated can these infections be? I mean, what's the worst thing that can happen if any woman actually contracts any of these infections?
Now, infection, like I said earlier, if handled on time, can save so many things. But when you leave it untreated for a long time, one, you tend to have what we call pelvic inflammatory disease. Yes, it tends to have that. It also helps to, cause, it causes cis menstruation or scanty menstruation, and this thing also causes hormonal imbalance. And when the hormone is imbalanced, definitely it disturbs every vital hormones in a woman's body. That is when you now get to hear a woman telling you she has fibroid, she has ovarian cyst, she has blocked fallopian tube, and then for some it could be ectopic pregnancy. And when such thing, because there's something about us women, when they notice this thing, they come to you for solution, without wanting to know the root cause of the problem. They want you to just give them anything. But like I always tell them, it's either you're doing a test with me or you go to the lab for further evaluation, so that we know the root cause of the problem. That way it makes it very easy for us to handle it. And when this thing starts becoming inflamed in your body system, you have liver problem. And when the liver is sick, definitely it will start introducing some other diseases in your body. So that early stage of addressing the infection is very, very important.
Okay, so before you take us through the symptoms, we'll get to that. Before we get to the symptoms, can you run us through the preventive measures? What are those things that women can do to first prevent themselves from entering into these things, if possible?
Well, it can be prevented. One, we have to be, hygienically conscious. Like I always advise my women, if you must wear pants, let it be a cotton pants.
Okay, not net.
Yes. Either cotton or net.
Net, okay.
Where the vagina can at least have hair. going inside of it.
Yeah, it should not be too tight.
Not too tight. If you wear something too tight, it doesn't allow hair penetrate.
Okay.
Then you see some women using soap, medicated soap, to wash their vagina.
Okay.
Such things can be. The vagina is self-cleansing.
Okay.
You don't have to wash it with anything chemical. You see some women using their hand to dip into their vagina all in the name of wanting to wash or clean it. Your fingernails might be having bacteria inside of it. Then you just succeeded in introducing bacteria into your vagina. So all these things can be prevented. Like a woman that's seeing her menstruation, the kind of pad you use matters. And the number of hours you use the pad equally matters. Then when you go to sleep in the night,
Ma, please, let's not jump issues.
okay,
The type of pad matters. So
yes.
Please tell us why, and then the number of times you change it. Please tell us, because I'm sure maybe some people are hearing this for the first time. So I want them to really learn and then see reasons with us why they must be to do
Now the
this.
type of pad you use matters. Like I recommend Kelly pad for most of my clients. Why? Because it has anti-inflammatory chemicals that fight all kinds of infection. Apart from the fact that you're using it for your period,
Exactly.
it has some anti-inflammatory chemicals in it that helps to fight infection. So such pad is recommended. And when you see your period, the least hours you carry your pad, 6 hours is okay. Whether you are stained or not.
Okay.
6 hours is okay. Anything more than that, you are triggering something else into the vagina.
Okay.
And you know our vagina is very open. So we have to be very careful.
Okay. And then for the toilet infection and those other infections we talked about, how can they be prevented too?
Now the toilet infection, which is the vaginitis, you have to wash your toilets. Like when you go outside, like personally, I don't use public toilets. But if it happens that I have to, I'm so pressed, I see myself in a place where I have to use their, their toilets, I flush first. That way you tend to take away anything that was hanging there, the bacteria that were hanging there before you came in.
Okay. So some people, what I do, like for example, this office is an office setting, so you can actually come with your toilet to the office. You get it.
Sure.
So usually you flush first and then you clean the lid.
Clean the lid, yes.
Use tissue to clean, because it's possible that a male used it before you entered and has spotted your, has dropped some things on, you get what I mean, on it. So you flush first and you use tissue, clean the lid very well before you use. Very, very important. Thank you for that, ma. Okay. Now, this is the Dr. Katie. In case you're just joining and you're wondering what is going on, this is Dr. Katie, where we share knowledge and we liberate minds. Our topic for today is common infections in women. Common infections in women. Now, share with us what are the symptoms. And this time I want you to really take your time. Okay, for each of those common infections, share with us the symptoms. Now, the ones that have similar symptoms, just share them with us all together.
When it comes to infection, body differs.
Okay.
Some people don't even experience symptoms.
Oh.
Yes. I have a client that came to me like 4 days ago. She wasn't having any symptoms because when she gave me her complaints, I asked her, do you have an infection? She said no.
Oh.
I said, okay. Do you, I have to do a self-examination. What are you experiencing? Because from your complaint, I think there should be a trace of infection in your body system.
Okay.
So she said she's not having itching and the rest. I said, okay, can you do me a favor? Go to the lab. I want you to do a swab test. And she came back. She has an infection. A little growth of staphylococcus. So body differs. Some don't really have symptoms. But the major symptoms in toilet infection, candidiasis, apes, and the rest are itching.
Okay.
Women experience itching. Women experience painful sex. When they are having sex, they experience painful sex. Then hotness in the vagina when they are urinating.
Okay.
Yes, all this painful there's this painful sensation that comes around them when they urinate. Then they experience abdominal pain.
Okay.
Abdominal pain. Then some experience spotting. That's a spotting after period.
Okay.
After the menstruation, you still see blood coming out. That's spotting. So those are symptoms of infections.
Okay.
And like I said earlier, if you leave an infection untreated for a long time, it tends to bring what we call hormonal imbalance. And you start experiencing so many things in your body system.
Okay. All right. But is it possible that someone is experiencing some of these symptoms and it's not infection? Is it possible?
If you are experiencing that, there's every tendency that you're having infection. Because the symptoms I just mentioned are symptoms of infection.
Okay.
Itching, painful urination, painful sex. Those are symptoms of, and before you start experiencing that, that means the infection has started touching some areas that it's not supposed to touch.
Okay, so where then can we place the part of an increase in the length of your menses? Where can we place that? Can we say it's one of the symptoms of infection or any other thing?
Like I said, an infection left untreated for a long time tends to cause hormonal imbalance.
Okay.
And when your hormone is imbalanced, it starts disorganizing your system.
Okay.
Inflammation sets in.
Okay.
And when the body system is inflamed, it causes disorganization in your body system.
Wow.
Your progesterone, your estrogen, your AMH, your FH becomes disorganized. And these are women's hormone that controls the menstrual cycle. So,
of course, it's expected. All right. Now, when it comes to sickness generally, you will agree with me that lifestyle plays a major role. Now let's get down to lifestyle with regards to common infection. We just talked about the toilets, usage and all of that, and the pad. Now apart from those two, what are the general lifestyle habits that women, number one, need to unlearn? And what are those ones that they need to adopt to stop or of course to reduce their risk of contracting some of these common infections?
Are we talking of the diets that causes it?
Yeah, no, I'm talking about the lifestyle.
Okay.
For example, there's the part of taking alcohol. I don't know if it has anything to do with this.
Yes.
And we've talked about the toilet usage, which is very, very vital, very key. And then we've talked about pads. Yeah. Okay, so what other lifestyle issues should women look at? There's another thing I think I remember, your underwear.
Yeah.
Cleanliness.
Yes, very important.
So women can use one underwear for you know what it is, and it will take someone to take that in the smell before they go and wash it. Okay, so are there other things that women need to look at?
Yes.
In regards to hygiene and general lifestyle.
Yes, like you said, our underwears. I'll say generally, maybe because of what is happening, we don't like drying our underwears outside. It's very important that the sun, the hotness touches what you wear under you. Now, in absence of that, you can use hot iron to iron your underwear when you know that the thing was not kept under the sun. The heat helps to kill any bacteria that is there. You can even once in a while use hot water
to wash
your underwear. It helps to kill the bacteria.
Okay.
And now when you talk about the kind of diets, the diet, the lifestyle that some of us take that causes this thing, too much of red meats. Yes, because sometimes this red meat we eat, you don't know where the animals were brought in from. So there's every tendency that there's one sickness in that processed meat. I don't know if I'm making sense. Before we buy and eat, it was not prepared by you. Maybe you bought from somewhere. You don't even know how it was prepared. Processed food. This kind of food are not really things we should introduce into our lifestyle because they have their side effects. Such things can trigger of all these things.
Okay.
I don't want to demarket any company here. I would have mentioned some things that we take that are not really good for the body system, that triggers some kind of infections in our body system as a woman.
Okay. Okay. All right. So, as one of you major in nutrition and women health, and just delved into diets. Now let's look at it from another angle. Are there maybe fruits, or are there certain foods that women should take, okay, that will put us at lesser risk of some of these things?
Okay, now as a woman, you know, like I said, infection triggers your hormone. As you age, your hormones are things you should pay attention to, and equally your liver, your kidney, your heart, and the rest. Now, those things you eat when you were very young, you don't adapt them into your lifestyle when you get to the age of 40.
Okay.
So once in a while, a woman can adapt the system of wanting to do what we call diets, maybe once in every week, or in 1 week in a month. You can do what we call detoxification. You can just decide that this month, for this week, I want to do something to my body system. It goes a long way. Detoxing, taking of fruits. The time you take the fruits matters. Now, as a woman, detoxifying your system, even if it's once in a month, matters. Okay? After that, you can decide to do what we call intermittent fasting for a week. Like depriving yourself from some fatty foods, like fried foods, processed foods, like meats. You can take water between the hour of 7 o'clock. Then maybe the next time you take your breakfast, 11 o'clock. This thing should be plant-made food, prepared by you. And when I mean plant-based food, it should be food that are harvested. You can do that to your body system every week in a month, and you will experience a very fine body system. Okay.
All right. If you have questions, please make use of the comment section, and we will be taking your questions in the next few minutes. Okay, so as a seasoned medical practitioner, tell us, what should women do if they suspect they have an infection by virtue of some of the symptoms you mentioned? Okay, for example, if there's a woman watching us and she says, hey, is that why I've been scratching for some days now? Or, okay, is that why I've been experiencing this or that? What next? What would you advise her to do next?
Okay, now if you're having that experience, I will advise you go to the lab, you go see your doctor, which of course he or she will tell you the kind of test you need to do. Then when you do the test, that way we'll be able to diagnose the kind of infection the person has, which makes treatment very easy.
Okay.
Then you come back to your practitioner, then definitely is going to advise you on what to do, what to take, and how to address it.
Okay. So go for a test first.
Yes.
All right.
Very important.
So in your clinical experience, I want you to take your time and share with us the KEDI product combination for some of the common infections that you mentioned.
Okay, now when you have gone for diagnosis and you now know the problem, which makes treatment very easy. For the KEDI product, I always tell people, KEDI product is very effective and the efficacy is top-notch. But the thing is this, you have to be sincere with your clients. The product is not something you take once and you get results. You have to be on it consistently. And when you are on it, your diet matters a lot. Now, before you start giving treatments with KEDI product to your clients, first and foremost, very important, detox with colon cleanser. Okay? KEDI colon cleanser is very important. You use it to detox your client for 5 days. 1 or 2 tea bags. You make it in the morning and you keep it and take it as a tea lasting in the night. Then towards night or morning, you start seeing what will be coming out of your body system. Now, when you do that for 5 days, you now introduce reishi to your clients. Reishi products is very good for any kind of infection. In fact, I call reishi products, there's a name I call reishi products, my key products. Because every product you introduce reishi to, reishi helps to take care of it before the main thing comes in. Now, the second product is golden eye. Golden eye has a way of taking care of even those things you didn't know you had inside of you. Golden eye is very good for infection. Then, Gynafarm, I call it the women's food. Gynafarm is very good. It helps the uterus. It helps inflammation. Why? Because if you look at the ingredients in Gynafarm, they are fantastic. I don't know if other practitioners take out time to read the products in reading the most of the ingredients we have in Kelly products. They are very top notch. I take my time to read them because it's very important to me. Gynafarm is very good because Gynafarm fights every pelvic inflammation in a woman's uterus. Even takes care of the ovarians. If you have ovarian cyst or what have you, Gynafarm takes care of it. So those 4 products are very good for any infection a woman is complaining about.
All right, thank you so much, ma. If you have questions, please leave your questions in the comment section, and in the next few minutes I will be taking your questions. But before I get into that, let me leave you with these few announcements. Now, the first announcement that I have here is for all our lecturers. If you're watching this podcast and you're a lecturer, please just wave at me in the comment section. All right. All our lecturers, this is for you. Now, our lecturer orientation training is ongoing at our training centers. Now, we have different days for different training centers. So please, I appeal to you sincerely. Look for the dates or ask to know the dates that applies to your training center, and then attend the training so that you can learn. Guess what happens when you learn as a lecturer? When you learn and improve your skill as a lecturer, it will rub off on your trainees, that's the distributors. They will become better at whatever it is you are teaching them. Do you understand? So please, you're a Kenny lecturer, please endeavor to attend the lecturer orientation training this month. Now, I am also pleased to announce to you that our March to May seasonal promo will be starting soon. Yes, it will be starting on 11th of March 2024. Okay, so please stay tuned to all our social media platforms for the promo flyer and the promo poster, okay, so that you can digest the promo criteria, get and participate because the prices are top notch this time. Okay, the prices have been reviewed, the criteria have been reviewed. But when you see the promo flyer, you say, hey, this one is them. Okay, so just get ready, stay tuned to all our social media platforms. The flyer will be released soon, and please get ready to buy. I want all of you to grab money this time. I mean, we're talking about money, real life money. So get ready to participate and win. Okay, don't forget that OPP seminar, foundation training and product training take place at our training centers nationwide. Please avail yourself of these seminars and training. We also have mega seminars and BBS. They take place nationwide in different locations. Please avail yourself. Don't forget that you can still advertise your business in the next edition of Kelly Inspire magazine. Yes, the window of opportunity will be closing pretty soon, but of course you still have about 1 week. If you are interested in advertising you want to showcase your business to the world, you want to tell people what you do, okay, contact the editor on 08033406476 or send a mail to info@kedihealth.com. All right. Give your business that global exposure that it deserves at affordable rates. All right. Don't forget that our social media platforms are active round the clock. On Facebook, we have a page at Kedi Healthcare Industries. We have an account, Kedi Headquarters Lagos. On Instagram, we are at Kedi Healthcare_official. On Twitter, we are at Kedi Health NG. On LinkedIn, we are at Kedi Healthcare. We have a YouTube channel at Kedi Healthcare. Not forgetting our website, www.kedihealth.com. Don't forget to download Kedi Care app today to secure your business from wherever you are around the world. Okay, so please, if you're watching Talk to Kedi for the first time, I would like to officially inform you that we are celebrating our 4th anniversary, and the next edition of Talk to Kedi will be our online broadcast. Will be the online anniversary broadcast. It will be a special broadcast for our 4th anniversary. An online quiz is ongoing, okay, for you to select who you want us to invite to the studio that day, and many of you have participated. Now another quiz will be rolled out next week to ask you the topic you want us to discuss in the special anniversary broadcast. Please just stay tuned. Don't forget that as you participate in this online quiz, you stand a chance to win. Winners will be randomly selected in the comment section. They will be contacted and they'll be given their special anniversary gift. So what do you have to lose? Make use of the comment section in any of the this anniversary quiz posts and hear your own opinion. We would love to hear from you. Let us know how you want us to improve. Okay, Talk to Kedi is for what are those things you want us to do more? What are those things you would like to see, okay, in years to come? What are those things you would like us to introduce? What are those touches you would like us to adopt? Let us know in the comment section. I hope you know that whenever you talk, we'll listen. Okay, so please talk to us this time. We are listening. Okay, wherever you are in the world, please join us as we celebrate the 4th anniversary of Talk to Kedi. Trust me, it has not been easy. It has been 4 years of impact. It has been 4 years of consistently dishing out information and knowledge. So please join us as we celebrate our online broadcast. It's a laudable achievement, and I want you all to be part of it. Special thanks to all our guests. Special thanks to all our viewers, okay? All our guests these 4 years. I mean, I can't even begin to count all of you. For the past 4 years, we've had different guests. All I want to say is thank you. I also want to thank all our viewers, okay? Because we keep coming here because you are there. Thank you so much for these 4 amazing years. And please, let's do this together. Ensure to always tell someone to tell someone to tell someone that Talk to Kedi is a broadcast that you must watch. Fortnightly, every Thursdays by 12 p.m. and you won't regret it. Okay, before I take my closing words, I don't know if Dr. Becky has anything to say to our women who are watching us with regards to our health. I have discovered, man, in fact, we'll be celebrating the International Women's Day in the next few days. Yes, the next few days. And I would like you to give us a punchline before we go. Many women kind of, you know, as women, we are nurturers. We nurture the world. We nurture our husband. We nurture our children. We nurture everyone. We're just gifted to nurture. Sure. Wherever we find ourselves, we nurture. But I have also discovered that we nurture, but many of us fail to take time to take care of ourselves, the one who is nurturing. We give and we receive less. I'm not talking about receiving money. Money is not really what it is. Okay, we give so much time, so much attention to nurturing the world than we pay to ourselves. Okay, and then because some of these infections, we find out that if you had paid close attention enough, you would have seen something. It's just like breast cancer. They say after your menses, take time, stand in front of mirror. It's not taking more than 5 minutes. After your menses, just stand in front of mirror, raise your hand, hold your hand like this and check. It's still too much for some women to do for reasons that I cannot really explain. So I want you to give us all, because we are all women, as we prepare to celebrate International Women's Day 2024, I want to give us a punchline. Women need to start taking their health seriously. Women need to start paying close attention to details in their body. Women need to start being friends with their body so that the moment anything goes wrong, it can be easily and detected early for better and easier treatment. Women need to start loving themselves. Women need to start embracing self-love. Women need to stop putting themselves under pressure. Women need to start speaking positivity to themselves and seeking to grow. So please, ma, before I give my own punchline, because me, it's as if I'm even yast it. Yes, we cannot just be celebrating International Women's Day for fun. We need to begin to speak to ourselves as women. So your own punchline for women as we begin to call it a day on this edition.
Okay. I had to laugh because, sorry, I'm bringing this in. A client called me yesterday. She sent her BP results to me.
Okay.
And it was extremely high. And I asked her, what's the problem? What are you thinking? Because when I started your treatment before now, there was no BP issue. Did you sleep in the night? She said she didn't sleep.
Why?
I said, why? She laughed. I said, no, I need to know.
Oh, cool.
If you know I'm your doctor, then you should tell me. She said, no, that she has so much to do and the rest. So much to do, even at the time you're supposed to be sleeping. Women, like you said, we nurture everywhere we go. Our husbands, our children, but we fail to nurture ourselves. When I was now talking to the husband said, Madam, I don't know.
At all.
She doesn't have any reason to have BP. I said, are you sure? He said, yes. I said, okay, don't worry, I'll come to that.
Good.
Okay, now, as a woman, your body, if you pay attention to your body speaks to you. Even before something starts going wrong.
True.
If you sit down, there's something we call meditation. If you sit down and you are meditating and something is going wrong with your body system, your body will talk to you. But because we always want to do everything at the same time, we ignore some things happening to us and we move on. A woman might have headache now. She'll just take paracetamol, drink, she don't water. The next time he comes, she'll enter cold water. She don't go. This thing is giving her sign that there is something wrong somewhere. But because she wants to do everything, she's not paying attention to herself. Women, that thing we cannot finish at that particular time, when we are tired, we can leave it and go back to it. I learned this thing as I grow because I am a victim of ectopic pregnancy. So I can categorically tell you what a woman suffers when you undergo such. Emotional stress and the rest. That thing you cannot finish at that particular time, you can leave it and go back to it. You must not finish everything at the same time. Now, when you have done nurturing others, take out time to nurture yourself. You need to give yourself a treat.
Hey.
You need to give yourself a treat. Once in a while, take yourself out. Oga, come take me out. Now my turn to go out today. Let me just go and feel cool. With all due respect, my children do it for me. Mommy, today, no.
Yeah.
We need it. We need to be, in as much as we are pampering others, we also need to be pampered.
Of course.
And thank God for the kind of husband some of us are married to.
Okay.
We need to be pampered. Pay attention to your body. Before this cancer thing starts developing, it must have given you a sign.
Yes.
Anything you notice that you don't understand, try and get yourself close to a practitioner. Ask questions. Don't always tend to do self-medication. Self-medication can destroy so many. Unite with past friends, like your alumni. You just have to make yourself happy. Because the world cannot come crushing down on you.
On you alone.
Try and make yourself happy. You need it. We need it. Before the world collapse on us.
That came really sharp. I don't know if mine will be sharp. I don't know. But let me first laugh. If I drop my own bomb before we now leave the studio. This and we're going to do it together because as I drop, I don't want it to be too hot so that we will not scatter. So as I bring it, I would like it to come in. Now, we will be celebrating International Women's Day 2024 in the next few days. Okay, that was actually birthed forth this topic. That was why we chose to talk to women today. Now I'm closing my tab already. You see, women, I feel it is time we begin to talk to ourselves.
Sure.
Yeah, I think it is time we begin to have more forums where women talk to women. And I feel that as we begin to talk to ourselves, it's time that we begin to consciously prepare our minds to listen. Now, as a woman, please love yourself.
Sure.
Nobody will love you beyond the way you love yourself. That's bullet one. If the love you have for yourself is 0.00%, please do not expect any other person in the world to give you anything more than what you have for yourself. Self-love is key. Whatever type of love any other person promises outside the one you have for yourself is secondary. Is that one you have for yourself first? Self-love is what will make you eat the right food at the right time. Self-love is what will make you exercise regularly. Self-love is what will make you drink water, hydrate yourself
Regularly.
Self-love is what will make you seek medical help as soon as you notice anything wrong in any part of your body. Self-love is what will make you constantly improve yourself and make sure you become a better version of yourself every year. Self-love is what will make you consciously determine not to be on the same level year in, year out. Women, nobody is coming to push you. Nobody is coming to move you. But guess what? The world is changing. As women, you know, kind of those days that you say, I might be the rich man, let me just sit at home. Even now with the economy, rich man now doesn't
It's eating everybody.
Do you understand? Please get up, sit up, brush up, dust up, do something, grow up, become better. If there's anything you need to learn it now.
Learn it. There's so many skills to learn.
Do you understand?
So many.
In fact,
there's an empowerment we are trying to do to empower women. We need to do something.
Ma, do you know I saw a video yesterday? That's what triggered me to be doing all this sermon. I saw a video yesterday, ma, of a disabled lady who is a makeup artist, ma. Do you understand what I mean? She's disabled, she's a makeup artist. Please, ma, what is your excuse? And complete, this one complete, leg complete. What exactly is your excuse?
Every time waiting for our husbands to do
why in the world?
The Bible says we're supposed to be an helpmate.
See, the topic is still the topic, common infection, but now we are talking to women. you know, the topic actually has women in it. So we're taking that women part. We're talking about the common infection part. Do you understand? Now we're facing women. Okay, so we're still on point. Please, women, I urge you, as we prepare to celebrate International Women's Day, these are things we cannot post on our platform, but we can say them here. Please, be happy. Like Mama said, make yourself happy. Nobody is coming to rescue you. This life now one.
That's why women fall into depression.
Depression, you know, is you are depressed, you drank a sniper, drank this one.
I read something yesterday that was so touching. A woman, the husband left her because of the economy. Things became hard. He lost his job. She now took the 3 children to the police station, dropped them there, pulled her clothes, run into a moving vehicle, and the vehicle crashed her down. Why? If she had something doing, at least she can support.
So as we close, please, I want to honestly beg you, get a life.
Get a life.
Build a life. These are my take-home points. Get a life, build a life. Whatever it is that gives you joy, invest in it. Do you understand? There must be something you can do. No human being was created empty.
Yes.
There must be, you just not discovered it. Okay, even if you've not discovered anything, but you can at least become a Kedi consultant. Start with something.
Yeah, another start from home.
Just start to get so your house. You don't even first need the shop first. First leave service center matter one place first. Register. You're a woman, they're watching, you're a Kedi distributor. You can even start with that one. You are there screaming, the economy is harsh, so what will we eat? Start somewhere. I've had cases where many distributors joined without having any money. They joined, the first customer they got, the profit they made was what they used.
Another beautiful thing of enjoying Kedi and being a Kedi distributor, if you don't know it, you can partner with other distributors. And grow. That way you grow.
Actually, that's
partner with others. They teach you. Those that are in the field that knows it better will teach you how to go about it.
Okay. We have a frequent. Why am I shaking?
Why am I shaking? Well, I'm not surprised. Well, the number of questions that are coming in.
Okay, so I have this one. This one says from Inya Ebe. She said she has been waiting for the announcement of March to May promo. I should please go over it again. Okay, Mama. In the next few days, say in the next 3-4 days, the promo flyer will be on all our social media platforms, okay? But the best that I'm allowed to tell you now is number one, the promo is now entirely different, completely different, special and unique. The promo criteria has been changed. The prices are now higher and superb than they were, okay? What else can I also tell you? Okay, this edition, all distributors can participate. You know, before it used to be certain levels. This consultant to this consultant, remember, this one now open all distributors. As far as you are a registered Kedi distributor, you can participate in this particular edition of March to May promo. So in the next few days, the flyer will be out and all the criteria will be there. Digest it and please start on it. If I see the money, if you see the money inside this one, now the money concern because it's actually a way to help our distributors pushing the effects of the biting economy. Okay, that is what the promo is actually all about. So what we did is to make the criteria simpler. We made the criteria simpler and then we made the reward higher. Okay, why? All because we want our distributors to participate and then grab enough money to cushion the effect of this biting economy. That's about it. No more, no less. So please prepare. All Kedi distributors nationwide, prepare to participate in this promo. It will start in the next 4 days. Okay. Dr. Becky, you are welcome. That's from Bethel Unique on our Facebook page. Okay, we also have from down. This is a question and it is for you because now you be the doctor, not be me. So it says
the doctor to doctors.
This one says from Amarachi Azuna, one of our loyal viewers in the world. Yes, she said, what can cause one to spit or vomit blood occasionally?
What can cause one to
spit or vomit blood occasionally?
That's where diagnosis comes in.
Okay. Okay. So, Mrs. Amarachi, has the person gone for tests? Yes. So, if the person has not gone, please encourage the person to go for a test.
So many things can cause it. So many things can trigger it. But what is that
exactly
thing? That is what we want.
So when we know what is exactly, we
now
know
how to address it.
Okay, so the person needs to go for a test as soon as possible. Don't forget, early diagnosis is key.
In fact, the person should even start going now.
No. Okay, maybe the person should give us 2 minutes. Let's call it a day first. Okay, the person should actually go for a test. So the result of the test will now help us know what exactly the problem is and what should be administered immediately. Okay, Paulo Ajibade on Facebook page is saying nice one. He's giving us thumbs up. Now he's watching from Calabar. Thank you so much for watching. Women all over the world, we love you. Both of us are women, so we are representing you in the studio today.
Sure.
We love you, and all we are saying is please protect yourself, live healthy, eat healthy, sleep well, rest well, drink lots of water, exercise regularly, love yourself. Please don't be depressed. No matter what is going on around you, the economy is biting hard, we all know it. Join Kedi business at least to cushion the effect a bit, okay? And please stay sane, no matter what. Even the heat set when they contribute. And sometimes you're like, what? Which one you want face? You know, the economy is biting hard, the heat can't be bite hard. Which one do you want to kill? But please, no matter what it is, love yourself and be happy. The world will not come crashing. Like, I want to use those your words. It will not come crashing on only you. The young man say, oh, when you are born, we'll show where they come. It's not only on you. with plenty under them, okay? So just be happy and love yourself. I remember Sarah, I didn't know. Thank you for watching. I'll see you in the next edition, which is the special anniversary podcast of Talk to KD. It's our 4th year anniversary, people. See you. Bye.